this is something that I've been asked quite often, and yet it is the pain you can't explain. I do find it really difficult to articulate in straightforward words what the pain is like. Period pain just it has this like sort of dull, achy undertone, which endometriosis feels like, but with super strong stabbing pains at the same time. It almost felt as if to me, and I always said this to somebody, like, you've got that diagram of your fallopian tubes here, like that. It was almost as if someone was like wringing out a towel, like this like twisting, sharp, painful sensation that was the only way I could clearly, like someone was really drawing the water out of a flannel with my fallopian tubes. That's how it felt. When that was like the height of the pain, but underneath this like dull undertone of like pelvis headache is what I can say. It's a very strange one to explain, but you do know the difference, because obviously endometriosis pain you don't get when you're on your period. It's all the time. Sharp, stabbing, twisting sort of pains is my experience of endometriosis. I know a lot women have a lot of different symptoms, but that's how I would best explain it.
I think herein lies another problem is each patient with that may have a different bit of a description or a different cyclic description, and also, yes, based on essentially the real estate, right? So if your endometriotic implants were on your ovaries, fallopian tubes, the outside of your uterus, or in this case, bowel, bladder. So see, some wouldn't have the bowel or bladder. They may just have that twisting like you're talking about. And some, it may be one-sided, opposite sides, both sides. So there's the variability in it, I think, adds a layer of difficulty to the description and ultimately the diagnosis thereof. This is a persistent pattern that's now interfering with your daily life, your quality of life, the quantity of things that you're trying to do in your life, even as a very young person. And so to understand how deeply this affects, again, is another indication for we need to stop and take a really good look at this, take a good hard look at it.
Yeah, for sure. I definitely felt that, I came in, I had the big hooped earrings and my hair all done in a certain way. I was 15. Yeah, I thought I was the coolest person ever. But that shouldn't have mattered when it came down to the hard stuff of what I'm telling you is the problem. So yeah, I felt that there was this idea that you're not dainty enough, you're maybe not blonde and blue-eyed enough and precious enough to be listened to. When I speak to women, especially women of colour who are dealing with the same thing, there's this idea that we have this like superhuman brown, black, Asian girl strength that just means we can carry on and crack on and nothing affects us or hurts us, whether emotionally or physically. Obviously my thing was physically. And that always felt like an undertone for me. Like you had to work just that little bit harder to be listened to, or you had to word things in the correct way, rather than someone just going, "Oh, please, I'm really in pain," and instantly being listened to. So yeah, quite another frustrating element that I think maybe made it harder for me to finally get that diagnosis and then treatment. So from 15 to 17, 2 years around about it took to be listened to. And I was very fortunate to be seen through fluke, really. I can't remember why. A certain hospital was taking on a few NHS patients, and I saw a private doctor and I told him my symptoms, and straight away he said, "That sounds like endometriosis. We're going to do explorative surgery." Yeah, it turns out I was riddled with scar tissue. Every question he asked me, yes, I do feel that. I specifically remember that day and that hospital and what the ward looked like, because I came out and I said to my Mum, can you believe that? Like, he just listened to me and instantly it's like he knew what was wrong with me. I feel like we're finally getting somewhere. And it was just this like, this isn't just a Remi illness. This is actually a thing that I can explore and possibly have some level of treatment for. And it was just like this relief, like finally something's going to be done about that. And I smile because it was at the start of a lot of pain, but I smile because I remember that day and being like, I actually think this might get sorted now. Relief of just finally being listened to as well.
Yeah. Yes. I think it's very important to keep an open mind about this diagnosis at an early age, not just something that we see later on in life, in maybe the 20s or 30s, and then be very open as providers to that symptom complex and how it's being described.